Hi, my name is Francesca Sebastian, and this is my assignment number 1 for healthcare delivery in Canada. So here's my table of contents. Really quickly, these are all the things we've talked in class as of for now. The main ones are the module 1, which is more worldwide, and then it goes more into Canadian healthcare topics. So system thinking, I really like this image is because it shows that there's many different people to do the same kind of final product. And really, I think it's a vision of a certain aspect or product within a system. And there's many people around the system that can help create or, plan, arrange issues, make decisions, or any impact that has to do in the whole system. And here's an example here that shows that any sustainable design that's done or any changes that is done within the system or the cycle here, it's good to have different people put their input in it to make a better decision. And here's the term, everybody has a health state, I like to call it. And it's really because of their lifestyle. So any of these bullet point here shows that it can bring some stress or healthcare could be an issue there at the long term. And I've mainly researched the work condition because I know so many people that even though they make a certain amount of money to be able to pay their housing, they still don't like their work environment, and in the long term it can affect their health, emotionally or any other health. So the World Health Organization is something that we've discussed in the course. And before to talk about Canada, it's good to talk about the globally what they do in healthcare. So they have many functions here that I've listed, but basically I like to talk about research, which touch also global information system because the research will touch any other country. But they do basic research, but also a lot of applied research on vaccines and different diseases to help underdeveloped countries. And they have many goals here. I've mainly researched the child mortality. Here's their target. So reduced by 2/3, hopefully in 2015, and right now they're at 7.6 million in 2010. They were at 12 million in 1990. So they've reduced, but not quite at 2/3. And it's been good because under 5 deaths has been improving, but unfortunately the under 1 month of living life, the death's been rising, which is kind of it's kind of to keep in mind here. And then measles is one of the biggest one that they really they did some research and they need to make sure that 2 doses is given to children, and hopefully funding is not cut in there. And determinants plays a big role, obviously. Mothers and parents that don't have very much education maybe don't know that vaccine has to be given. That's just an example of how important it is to make sure everybody knows about it. And worldwide, here's just a database that is awesome to compare different countries for different things. And here I've compared Europe with Canada because they're so different from us. Then we see here that life expectancy in France is bigger and the infant mortality rate is smaller, but they do have a lot more physicians and less nurse that we do. And then I've just compared here Canada in 30 years how much it's changed, and it did change accordingly. So the Healthcare Act in 1957, we only had insurance for hospital care, but now in 1966, in 1968, all provinces were in the Medical Care Act where we can have insurance in other institutions. So fee or no fee. Here's another hot topic, I think, in our course where should we pay or should we not pay? And I think we shouldn't. And I like this picture for that because it really shows that it will just be another tax or another fee that we'll have to pay. And for now it's free and it should remain that way for many, many reasons. And here is how Canada pays, where the health dollar is going right now. And other professionals, 10.5%, but we cannot forget that there's a lot of private insurance that pays for other professionals, and that can become a problem as well in the user fee section. And in my own research paper, I will be looking at how we pay our doctors. There's two different ways. There are ARP programs and fee-for-services. And I wish to know who decides to, how they get paid. And if it does affect the service to patient, I feel like fee-for-service people would get less of a service than ARP programs where they get paid per hours and not per patients they see. If you have any questions, you can email me. Thank you very much.